to our webinar. I really appreciate the time that you're taking to listen to us, to learn a bit more about this, and also to take the time, should you want to address some of the questions or the most common questions that we are receiving on a daily basis. Now, I'd like to begin this sorry, 1 second. Just, I'd like to begin this by checking which are the main objectives of this conversation, of this webinar. One is going through a general definition of what actually is autism spectrum disorder. I don't plan on digging too much into it. I am pretty sure that by this time you know a lot more than we do about what is it, what it consists of, how is it diagnosed, and all that stuff. Basically, what we want to run is have like the basic ground of what ASD is, in order for us to be able to explain how the stem cell works, what type of valid, legal, authorized stem cell therapy sources we have, and obviously the approaches. And finally, we want to top it off with discussing or describing some of the potential improvements that families have been able to achieve. Now, what is autism? As a spectrum, you know that it consists of a very large array of symptoms. However, per definition, it's a disorder that traditionally affects behavior, communication, and social skills mostly. I am very well aware that there are patients that have a lot of different symptoms, because it's not entitled only to 3 areas. However, again, per definition, those are the 3 areas that are needed to make it a valid diagnosis, especially at early ages. Usually symptoms start to pop up by between the 1st to the 2nd year, in order to make official, if it's valid to say it in quotes, an official diagnosis by maybe 2.5 years of age, perhaps 3. Now, as a syndrome, as an actual spectrum, it impairs, it affects, impacts in a negative way the general interest of the kids, restricting them how in order for them to perform. And they also tend to express some sort of repetitive behaviors. This is also known as a form of stimming. Now, some of the symptoms that are negatively impacted in our patients, if we compare them in a neurotypical sort of way, are the gut, the gastrointestinal system, immune system, comprehension, and social skills. Those are if we want to increase the variety of symptoms, those are the most common ones. Now, I'd like to go slightly deeper in these two aspects. What are the potential causes? This is the main reason why there is not an actual cure yet for ASD. There are areas that must be evaluated, like genetics. Usually, statistics, epidemiology points to about 18% of the cases have some sort of background relationship. Usually, Fragile X syndrome is the most common one. Then we have some form of immunological insults. This is pretty much anything related to the immune system affection. I don't want to dig into vaccines or anything like that, but could be anything related that affects the immune system of the kid. Then anything that is environmental. Environmental could be toxins, could be heavy metals, could be pesticides, could be the food, could be anything, even sounds, anything that has a sensorial impact in our patients. And finally, something that is currently, well, not exactly currently, but it has been evaluated deeply, which leads to another or a sub-diagnosis of in autism, which is PDD-NOS, or pervasive disorder, not other specified, as well as PANDAS, which is related to autoimmunity. Now, that's the general overview of the actual potential causes. However, there are three main components within the spectrum. This is pretty much a rule, it's a triad that it's present in almost every single patient diagnosed within the spectrum. One, it's proven that there is central nervous system hypoperfusion. What does this mean? Basically, brain pretty much survives with fat, glucose, and oxygen. Hypoperfusion means that oxygen is not flowing adequately in different areas of the brain. Another key component is gastrointestinal or gut issues. This is mostly related to any sensitivity or hypersensitivity. It could be immunologically linked or independent, in which large molecules such as gluten, casein, soy, amongst others, can actually cause inflammation, distress, and some sort of lesions in the mucosa of the gastrointestinal lining. And finally, and the most important one, is chronic inflammation. This is mostly associated with immune system dysregulation. Some other tag the word of dysfunction. And this also leads to some form of neuroinflammation, which is one of the most important areas that we have to discuss. Those are the three components. And this is the important part that I want to make very, very clear in order for us to be able to describe how stem cells work for patients who are diagnosed within the spectrum. So how does it work? This is going to sound a little bit ridiculous. Don't get me wrong, I like to understand things in the most simple and basic way. In a regular, neurotypical, everyday, basic situation, there should be a balance in our body. There should be, we should have a happy gastrointestinal performance, and we should have the most adequate homeostatic balance, happiness. I don't know how to say it. The idea is the main concept is that everything should be in total harmony. That is how it's supposed to be. However, as I mentioned a couple of seconds ago, when we have an actual immunological insult, what is going to happen? We have this. We have one agent, whatever it may be, right? We have any of the agents, could be, again, genetic, environmental, immunological, and what is going to take place is that this agent is going to cause some immunological distress. So this is going to translate into a constant fight. As this tiny image says, nobody goes into the body without a war. That is what is actually taking place every day in our bodies. The difference in the kids who are diagnosed within the spectrum is that this war, this constant attack of whatever agent is going into their bodies is causing this massive fight. And although it sounds like a natural thing to take place in our bodies, because it is, in the case of our patients, what we are concerned about is the chronicity of this fight. It takes place every single day because our immune system, the immune system of our patients is pretty much overreacting almost to everything. Something as simple as a diet or something as complex as smells. So this stress in the immune system is going to release a bunch of markers that, instead of being addressed by the immune system is actually not taking care of them. And these are the culprits, basically what we know as pro-inflammatory markers. These four are the most common ones that are present in any single tissue that is related to inflammation. So in other words, what is happening is that homeostasis, that harmony is not achieved. The harmony that we're supposed to be in is not achieved. Why? Because of any other immunological insult, hit, distress is pretty much impeding this harmony to be achieved. And these guys are the cause of it. I hope that this tiny explanation clears it up. The idea is that we have a very toxic environment, and the more toxic the environment is, the more complicated it is for you as parents, for your doctors, for the MAPS doctors, biomedical doctors, to try to take care of everything, because you do not know which is the main attacker. You don't know which is the agent that is causing this cascade of inflammation. And even if you find one thing, possibly there is another one that needs to be addressed or identified as well. Now, what are the effects of the stem cells? We have the conception that stem cells are a group of cells that go into different areas, they stay there, they home or they attach, they glue themselves into the areas that are damaged and start repairing that area. That is the concept that everybody had about stem cells 2, 3, 4 years ago, which is partially true. But nowadays, we know that stem cells do not only migrate to these areas and they just transform or become into one particular type of tissue in order to patch it and try to fix it and recover it and improve the performance of that piece of damaged tissue. What happens in reality, aside of that, that is just a tiny part. How that takes place, it's pretty much because of this immune system regulation. Without the regulation of the immune system, the immune system of the patients will not be able to respond the way it should be responding. So what is going to take place is that this hyperactivity, hyperreactivity of the immune system of our patients should not be overreacting to the agents that they are receiving. And also the regulation of the immune system is going to lead to express some form of anti-inflammatory effect. Once again, remember a couple of slides ago, one of the main issues in autism is the chronic inflammation. So the idea is try to actually bring it down. Now, second area in which the stem cells can actually bring a positive impact, which is perfusion of oxygen, where mostly in the brain. How does this take place? The stem cells have this ability to actually promote some form of oxygen perfusion because there is a particular marker embedded in the stem cells that promotes vessel formation or vessel repair. So if we have an area in the brain that there is lacking, is not performing the way it should be because of lack of oxygen perfusion, stem cells can help in this spot. And finally, promote differentiation of repair cells and tissues. As I said, this is one of the parts. However, how is this impacting in a positive way in our patients? Again, it's not only that the stem cell will differentiate into a intestine cell or into a neuron-like cell or anything like that. The idea is prevent premature cell death. Let's remember, everybody's talking about methylation. Everybody is talking about how to promote and keep methylation, protect the mitochondria and all that stuff. Sure, that is very important. Without mitochondria, without methylation, there is not actual cellular performance. However, if you have a cell that is about to die, also known as apoptosis, if you have an already programmed death cell, that is going to be a pretty much useless cell. So the idea of the stem cell is with all this regulation, the cell can actually prevent a premature cell death. So, and as a bonus, the stem cells do have some sort of antibacterial response. It's in fact one therapy that has been used in in conjunction with different therapies for patients who are going through sepsis. Now, when we are talking about central nervous system relation, what is going to take place with the stem cells? Once again, there is the conception that the stem cells cannot transform into neurons, cannot transform into anything brain cell related. Technically, embryologically, that is true. However, as I said before, the stem cells can actually promote some form of neuroprotection because the cells are able to prevent cell death. So if you maintain the form, the function, and the activity of cells, you are actually protecting the neurons. Neurons are still cells. Now, what is this going to translate or to transpire into? Improving neurogenesis or promoting some form of neurogenesis based by the and promoted by the own repair mechanisms of the body. And the most important thing, improve synapses, right? Synapses is pretty much the communication from one neuron to another. Let's say instructions from left to right should go perfect in the communication between neurons. If there is a blockage, if there is lack of communication, if there is inflammation, if there is something impeding communication from one side to another one, those instructions are going to arrive or to perform incorrectly. And finally, one of the things that it's very commonly asked when we have the conversations with the parents is, what about the immune system? The cells can help the immune system. The truth of the matter is, yes, they can. They can potentially help to restore or to reboot or boost the immune system of our patients and maintain some sort of balance. However, I'm going to skip ahead a little bit, and it's like a spoiler alert. This is very important because the cells are not able to do everything by themselves. Keep in mind one thing. We need a little bit of cooperation from the parents. We need a little bit of cooperation from the therapists. We need a little bit of cooperation from your doctors as well. Why is this? Remember that a few moments ago we were discussing about insults, pro-inflammatory insults. The stem cells can help to bring down inflammation. However, we need to identify, or we can help you identify, or we need the help of your therapists and doctors to identify what are the biggest insults for your immune system. That's why I have in here, the first thing that everybody suggests as a treatment for a kid within the spectrum is, let's change the diet. Which one? Whichever you want, as long as it's clean. There are patients who try gluten-free. There are patients who try casein-free. There are patients who try gluten and casein-free. There are patients who try the FODMAPs diet. There are patients who try elimination diet or raw diet, vegan diet. Doesn't matter. As long as you are actually keeping trace of what you are eating or what is your kid eating, you can actually identify how your kid is improving, even if it's at one tiny area. Once again, you are just helping to maintain that balance, that harmony that should be present, mostly in the gastrointestinal system. Remember, that is one of the key factors present in every single kid within the spectrum. Now, stem cell sources and stem cell approaches. This is a common question, and it's also a common comparison. I do encourage you, when we have a word with our patients or potential patients, they say, what is the difference between you as a clinic and other places? Everybody has their own protocols, everybody has their own methods of working, everybody has their own, everybody defends what they do because everybody has seen different results. I don't know how many of you, ladies and gentlemen, families, everybody who is listening to us, I don't know how many of you do know that we have both type of stem cells here in our clinic. We are actually able to provide autologous stem cells for our patients within the spectrum, as well as we are actually able to provide allogenic stem cells. Quick review of them. Autologous stem cells, as the name says, autologous means a cell or a stem cell that is coming from the same patient's body. So it's harvested from our patient. Usually, there are different sources. The source that we use in our protocols here, because it's very easy to do, and it's the most comfortable for our patients when we are talking about autologous, it's bone marrow-derived stem cells. One of the advantages, this type of cell cannot be rejected. It's impossible because it's a tissue coming from that patient. Another advantage, that tissue, that cell can be actually banked in the case families wish to repeat the treatment in the future in order for that patient to avoid a future bone marrow aspiration. this is another spoiler. The fact that a patient is using their own stem cells does not mean that the stem cells are wrong, that the stem cells are broken, that the stem cells are damaged, that the stem cells are malfunction. So there are some cases in which we do recommend the other type of, or the other source of stem cells, but that is something that has to be addressed individually because, as we said in a previous video a while ago, everybody has different needs. Therefore, the attention should be personalized because this is not like a genetic recipe that will fit everyone. So the fact that the stem cells of the kid is not damaged because we're only using the repair mechanisms, it's the reason why we can actually use this type of cell to treat a patient within the spectrum without actually worsening the condition. This is a common question. If we use my son's or my daughter's stem cells, the condition is going to get worse because I assume that the stem cells of my son are damaged. No, because you are not transferring DNA, you are not transferring anything like that. We are just using and promoting the repair mechanisms. We are concentrating them and infusing them back. That is what is taking place. And another advantage is that patients are able to yield very, very high numbers of stem cells when we are talking about young ages. Usually pediatric patients and teenagers, everybody who is under the 21 years of age. When we are talking about adults, we may recommend the other type of cell because in adults, the quality and the quantity of the cells tends to go down with age. When you are under 21 and you are growing and developing physically, your stem cells are perfect and your stem cells can be used for this type of application. Now, on the other hand, we have allogenic cells. Allogenic cells, there are again different sources, as you may know, umbilical cord blood and umbilical cord tissue. Those are the common ones. You may hear about placenta, you may hear about the jelly, you may hear about some other form of allogenic tissue. These are not embryonic cells. It has nothing to do with embryos or abortions or anything like that. No, don't go there because those cells, we cannot even touch them here. Those are banned. So the stem cells that we have here in our bank in the clinic, the allogenic one, the donated one, are coming from umbilical cord. Now, what are the advantages? Obviously, there is no bone marrow aspiration. The cells are already prepped by the time the patients are here. The stem cells are usually limited by the weight of the patient. This is something that it's quite important to mention because everybody says, oh, one clinic is giving me 1 trillion cells, but you are giving me only 1 million. There is another place that they are telling you that they can give me 5 billion cells, but you are just giving me less. If let's be honest, if somebody is claiming just very high numbers, I am pretty sure that they are not talking about purified stem cells. So let's focus on what is actually taking place. We cannot infuse in a patient a very large amount of stem cells, regardless of the patient condition and age. It doesn't matter if it's an autistic kid or it doesn't matter if it's a rheumatoid arthritis adult. We cannot infuse a ridiculously high amount of stem cells because there may be a risk of dosages. So of overdosing, and the actual overdose can lead to some form of pro-inflammation, and that is actually what we are trying to avoid. So this is something, again, that has to be carefully evaluated. That is the nature why we like to have a word with the parents. We like to have a word with you guys before you come in here, and obviously to address your question. And also, there is a difference between autologous versus allogenic, and those are the markers being expressed by the cells. We can talk about those later. I don't want to dig in too much into it, otherwise we will take a lot of time. Now, as the title says, which one do we recommend? If we are talking about pediatric patients, our recommendation will be the autologous stem cells harvested from the bone marrow. Why is this? Basically, because it's the protocol that, not only in our case, but in terms of information, publications, journals, papers, research, this is the source of stem cells that has been vastly evaluated studied and is the source of stem cells that has proven better results if we compare them with allogenic. Both work. However, that is our recommendation. If we have to choose which one, we will lean towards the autologous ones. However, we had the case, hey, I want to try the other ones. Can we? Sure we can. That's not a problem. That's the reason why we have them here. Can we use them? Yes, we can. Now, once again, we have one recommendation. However, based on the actual needs of every patient, every family, and perhaps expectations and the history of what everybody has been trying, practicing different therapeutic approaches, we can determine which one can be more beneficial for the patient. Now, moving forward with the autologous stem cells, as I said before, they are coming from a bone marrow aspiration. I just want to debunk some myths. Bone marrow aspiration, if you Google it, you're going to find the worst pictures in the world. Don't. And I'm not saying this in a bad way. I'm not hiding anything. I want to be very clear about this. Everybody has their methods. Again, we have our own method of harvesting the bone marrow. And if we have a family or a patient that is currently watching us right now, you can actually, you know that we don't do any incisions, we don't do any stitches, we don't do anything that is creating a wound. What is going to take place is with one aspiration needle, we reach the hip bone, the posterior part of the hip, a little bit above of the buttock. We set the aspiration needle, we collect the necessary marrow, we remove the needle, that's it. It's a very straightforward procedure that usually takes between 5 to 7 minutes to take place. How is this done? Again, I want to debunk this myth because there are some families that believe that we are going to submit the kid and everybody's going to be on top of them and the kid is going to be screaming. No, that's not how it takes place. Our patients are comfortably sleeping, only sedated with sevoflurane. Why do we choose this? One, our patients fall asleep very quickly in about 5 to maybe 7 minutes, depending on how big our patient is. Second, we invite mom or dad into the OR where the procedure is going to take place in order for you to help us with the sedation of your child. Why is this? Honestly, comfort for our patients. It's always a lot easier for our patients to fall asleep when they have mom, when they have dad next to them, talking to them, singing to them, telling them that everything is going to be okay. They are just breathing through the mask and they will fall asleep. That's it, as simple as that. Now, another thing that I have to explain and I want to explain, once we have the bone marrow sample in our hands, the manipulation, the actual harvesting of the stem cells takes place in our laboratory. We do not use any kits. We do not have any universal kit or method to collect the stem cells. We have our own proprietary method, and it's done in the laboratory, in the which actually the laboratory is the image that you are looking at the moment, and it's under very strict regulations. Why? Again, maybe it's under the laboratory. It's way too much for what is actually needed. Yes, perhaps it is. However, let's remember that we have a bank in there, as well as we are treating with the product of a kid. We have to be, and we want to be, as careful as possible. Finally, the approaches. How are the stem cells infused in our patients? Two different approaches: IV infusion, the traditional IV line, and the other one, intrathecal infusion, also known as lumbar puncture infusion. Why both? Intravenous infusion to address or to help with the systemic inflammation, and the intrathecal infusion is to help with central nervous system inflammation. Talking about allogenic cells. Now, allogenic cells, as we said, it's a donated source of cell. Advantages: the stem cells are ready. This means that there is no need for any bone marrow collection or aspiration. Same thing, our patient is sedated using sevoflurane, I have to state, we use sevoflurane only. We don't use nitric oxide. We hate nitric oxide. Actually, here in Mexico, nitric oxide is never used at any moment. Nitric oxide is the gas that is traditionally, don't quote me on that. As far as we are aware, some dentists in the US and perhaps in Canada use nitric oxide as also known as the laughing gas for anesthesia or sedation when they are doing some procedures. We do not recommend nitric oxide in kids with autism. Nitric oxide in at least 50% of the patients, it may cause some form of delirium and perhaps regression because the metabolites of the gas are difficult to eliminate. That is the reason why we use the safe option, sevoflurane. Now, this is something very important. We don't buy the cells. We manufacture them. We have our own laboratory. Again, we have our own proprietary method to harvest the stem cells here in the lab. If we have 10 patients that say, I want allogenic cells, I have cells for 10 patients ready by the time that the patients desire. And just as with autologous cells, two different approaches: intravenous infusion for systemic inflammation, intrathecal infusion for central nervous system inflammation. Now, another myth to debunk. Why the lumbar puncture? Simple. The very famous blood-brain barrier. The blood-brain barrier is a network that is supposed to protect or isolate systemic from the central nervous system. And there is only 4, maybe 5 things that can actually go through the blood-brain barrier. 1, water. 2, different gases. 3, lipids or fat, also known as good cholesterol. 4, glucose, which is pretty much the fuel of the brain. And 5, amino acids, nutrition. That is what is actually supposed to go through. If we have the permeability of the blood-brain barrier is open, that means that we have a leaky blood-brain barrier, meaning that there is inflammation. There are some papers that point that some stem cells may go through the blood-brain barrier if they are infused IV. Sure, I'm not going to discuss into that, but this is the reason why we do the lumbar puncture, to bypass the blood-brain barrier. Lumbar puncture goes into the cerebrospinal fluid, not the spine, not the spinal cord, not the nerves. No, it's not related to that. We are talking about the actual fluid that provides nutrients to the central nervous system. We infuse the stem cells in this place, and this fluid is constantly recycled every 12 hours, meaning that the cells are going to be absorbed throughout the central nervous system, and we are actually making sure that at least 20 to 25%, depending on the size of our patients, the 20 to 25% of the cells, of the total amount of cells that we infuse in our patients are going to the central nervous system without actually relying on the small or large or medium amount of cells that may go through the blood-brain barrier, expecting for some of them to go through. So that is the nature why we do the lumbar puncture. Now, again, I like to talk about myths. The actual intrathecal infusion takes place while our patient is sedated, same thing, during the same time that the bone marrow is collected, is the same day and the same time in which the intrathecal infusion is going to take place. Advantages: it's a safe procedure, just like the bone marrow. It's done in about 5 minutes, 5, maybe 6 minutes. Age of the patient: the youngest patient that we have treated with LASD is 1.8 years. And the oldest, it's 42 years. So as you can see, we have treated patients from pretty much both ends of age-wise, meaning that doing a lumbar puncture in a 2-year-old or in a 3-year-old or in a 4-year-old, it's possible and it's safe. Something that it's a very common question, and I want to debunk it as a myth. An intrathecal infusion is not like an epidural technique. Most moms, obviously, mostly, they identify the intrathecal infusion as an epidural because it's a common thing to perform when a lady is about to give birth. The only thing that they share in common is the place where it's done. However, However, it's not an epidural. We do not leave a catheter in place. We do not use the large trocar. We do not use a pump. We use only something known as a spinal needle. We tap into the fluid. We collect some fluid, which, by the way, if we have a patient that wants to take advantage of the CSF collection, the cerebrospinal fluid collection, because we have to withdraw some of it in order to ship it to the laboratory of your preference because you want to study MTHFR mutation in the CSF, or you want to study some other test in the cerebrospinal fluid, we can do so because we are going to take it to withdraw some of this fluid either way. So, and again, I like to emphasize the only thing that the parents are going to notice when the procedure is done is a Band-Aid, a tiny circle Band-Aid. Once again, I like to emphasize one more time in the reason why we do the intrathecal or the lumbar puncture, to help with neuroinflammation. Keep in mind, stem cells are going to be strictly for the central nervous system with this approach. Finally, let's move with the last part of the last topic of the webinar. Potential improvements. This is quite a controversial thing because everybody is different. There are some patients that improve greatly in one area. There are some patients that improve greatly in another area. And there are some patients that improve mildly in 2 or 3 different areas. In the same way that there are patients that may not improve in any area. Now, what are the main expectations of the stem cells? Once again, let's take it back a few moments at the beginning of the webinar. Let's remember let's call it the triad, the axis, the connection between central nervous system with the gut and the immune system. That is the main goal of the stem cell usage. Immunological response or improvement of immunological response, improvement in gastrointestinal function by decreasing inflammation, and improvement in neurological response because of the same reason, decreasing neuroinflammation. That is the potential of using stem cells. Now, let's think about these 3 points as the 3 major obstacles. Let's pretend that these are a wall. This is a huge obstacle between our patient and the next milestone. If we are actually able to knock down this obstacle, even if it's only one, if we are actually able to knock down one of these obstacles, we can actually push our patients to improve in different areas. Which areas can this be? Sorry, my bad. Which areas? Based on our experience, we like to compile the areas of improvement in 5 different spots: gastrointestinal, behavior, motor skills, social skills, and language. Remember the definition of autism spectrum disorder. There are problems with social skills, there are problems with communications, and there are problems with behavior. Now, these areas of improvement, as you can see, there are different sub-points or tiny branches under each one of them. Like gastrointestinal, there are some patients that the diet variety can improve, better bowel function, better absorption. This means that the kid is actually gaining weight, stretching, growing in size. Behavior, attention, awareness, sensorial, body training, OCD, motor skills, gross motor skills, fine motor skills like riding a bike, combing, getting dressed, social skills, responding to eye contact, to social cues, social interaction, whether if it's with the peers the same age or adults, perhaps imitation. Language is it's a little bit more tricky because the language is not only talking. Language is responding to your name or listening to some sort of verbal cue, maybe saying as well as understanding the use of yes, no question, yes, no commands, follow some commands, maybe putting together some sentences or learning new words. Those may be the areas of improvement. However, as you can see, the list of these areas are numbered. Gastrointestinal is number 1, behavior is number 2, skills or motor skills are number 3, social skills are number 4, language is number 5. There is a reason why we display it this way. I'm pretty sure that everybody has listened this before. You cannot run if you do not know how to walk. You cannot walk if you do not know how to crawl. Pretty much the same thing applies in here. I understand that 120% of the parents of our patients are looking for social skills and language, mostly speech, obviously. However, I don't like to be the negative guy here. I don't like to burst any bubbles. Language and social skills can be achieved. However, if we are aiming for a number 4 or a number 5, we have to be sure, we have to address in the best way possible number 1 and number 2 perhaps. Okay, why is this? I'm going to give you an example of the different examples of patients that we have treated here in our clinic. When we meet our patients on the first days, we have to interview the family and understand how the patients have been doing and all that stuff. Now, one family says, I take my kid to ABA therapy, but I take my kid as well to 25 hours of speech therapy per month. Okay? How is your kid doing regarding speech with 25 hours of speech therapy? No improvements at all. And when you evaluate the kid, when you pay a little bit of attention to the kid, you realize that there is no attention and no comprehension. The kid does not even respond to his or her name because attention is all over the place. Or maybe the kid gets really, really upset when somebody starts to get close to them, and the smell, the lotion, or the touch, it's upsetting to the kid. So we have there perhaps a potential sensorial issue. We have there a attention problem. We have a comprehension problem. Perhaps we have a gastrointestinal function, a gastrointestinal problem. Could be something as ridiculous as constipation. And if the kid is constipated, that triggers one of the worst behaviors possible. So if that is not addressed, perhaps your 25 hours of speech therapy per month, from 1 to 10, maybe your kid is paying attention to a number 1. Again, I'm not saying that it's not useful. I'm saying that it will be a lot more useful if we address, let's say, the constipation, if we address attention, if we address comprehension a little bit better, and then we can focus or we can gear ourselves to language a little bit more. Also, regarding language, another patient, my kid understands words when I offer them the TV, a toy, when our dog plays with him, etc., etc. That means that the kid is actually has some form of language, which is learning or knowing the vocabulary, but the kid is not actually able to enunciate a simple word. Maybe the kid is actually able to babble, but is not actually able to dominate or to know how to say the words. Okay, maybe we don't have an attention problem. Maybe we have a motor skill problem. That means that the patient is not actually able to dominate tongue movement, lip control, jaw muscle control. There are patients that have a lot of difficulties to be able to blow a kiss, for example. So if they do not dominate the fine motor skills of the language, they can understand some vocabulary, but they will have a lot of trouble to enunciate it. Needless to say, putting some sentences together. So same thing with social skills. Social skills, very common situation. My kid is 5. We talk this week's patient, actually this week's patient. We have a patient right now, social problem, social interaction, and the mom says, hey, my kid does not respond when he or she is playing with other kids. Truth be told, it's going to be a little bit tricky when they are 4 or 5 years of age. Why is this? Basically because when you are 5 years of age, the rest of the kids, usually they just follow the game, whatever they're doing. Between each other, it's not that common for them to be prompting activities that promote social interaction between each other. For example, if you have a group of, let's say, 4 or 5 kids together, playing soccer or football or some form of a game, perhaps all of them will be running behind the ball without actually knowing, understanding the discipline or the rules of the game. However, it may be different, the social interaction of a kid within the spectrum with an adult, because an adult is actually prompting the kid to respond. The adult is actually throwing some cues. The kid is maybe following whatever interaction the adult is throwing at the kid. That is the reason why. However, it's going to be very important, once again, to address maybe there is no social skills because we have a sensorial background. So if the kid is overreactive to pollen, to dust, to smells, to sounds, to the touch, maybe we have an issue that we have to address before facing or focusing socials. Because if we have a hypersensorial problem, with all the respect to everyone, you are going to feel very frustrated because your kid is going to overreact or hyperreact or scream or maybe throw a tantrum while he or she is trying to comply with the request of the therapist, for example, regarding socials or ABA even. So again, that is the reason why I like to talk about this, the areas of improvement. Yes, it's possible for our patients to improve in this, and even in a larger amount of areas. There are like 120 areas in which a kid can actually improve. However, if we focus by area, there should be an order. Let's think of it as a pyramid. You cannot reach to the top if you do not begin from the bottom. Let's create a domino effect, following with the basics, finishing with the most complex ones. Now, having said the improvements and how the cells work, and obviously what is the goal of using stem cells, remember, inflammation, central nervous system, gastrointestinal function. The ones who have been here, you already know that we like to provide some suggestions after the treatment. And this is very, very important, having some homework to take home, which is keep up with your doctor, MAPS doctor, biomedical doctor, registered nurse, biomed, doesn't matter, whomever is actually taking care of your kid, keep visiting him or her. It's going to be very important to identify and control the pro-inflammatory insults. Remember, something as ridiculous as diet can be causing more inflammation than the stem cells and the body can address. Because it's complicated to address the inflammation, it may take, let's say, 3 weeks to address inflammation, but you can mess up 3 weeks of work. They can be messed up with 1 McNugget. So let's focus on that. Second, identify the needed stimulation. Not every kid needs ABA therapy in the same way. Not every kid needs social therapy in the same way. Not every kid needs sensorial therapy. Let's identify what actual therapy is needed. Another one, I understand the need of most of our patients that take their kids to 10, 12 different therapies in a month. That's cool because you are actually dying, you're doing the best you can to take your kid to the next level. However, how do you know which one is working? Let's identify what they need in reality. I'm not against any of the therapies. Every therapy works, but every therapy will work is if it is the therapy that the kid needs, not only the therapy that the insurance provides. Now, another one that is very, very important to keep in mind, we have to differentiate expectations of the parents with the actual changes that the kid is going, that the patients are going through. Why I'm mentioning this, it's going to be very important to divide, to separate your feelings as parents, as your feelings of what you want for your kid in a long term, let's say when your kid is 5 years, when your kid is 8 years, when your kid is 10, when your kid is a teenager, versus what your kid is actually improving at the time. The reason why I mentioned this is, again, you have to separate what you want, which is fantastic, but you have to work with what you're noticing at the time. Remember, let's focus on the domino effect. We have to begin from the basics and trigger good changes. Why? because skills have to be practiced, skills have to be mastered. Stem cells are going to help, remember, knocking down the obstacles, but skills need, the skills, you have to learn them and you have to dominate them, especially language. For a neurotypical kid, language is a process that takes 4 years in order for them to have a very basic conversation at their own level. If we have a 6 or 7 year old kid who is nonverbal, we cannot expect that kid to be able to have a fluent conversation in 2, 3, or 4 months. We need to start working with that patient in order for them to dominate motor skills, to dominate language, to start responding to some sort of verbal cues, to respond to the basics, yes, no question, to follow some commands. Remember, language is not only talking. And this is something very important, and I said it in the previous slide. Let's not saturate or overwhelm the kids. I'm going to use as an example the parents of our patients. When you go to work and you have way too much work, we are in the middle of a pandemic, whatever is taking place, and taking some space in your mind, you're going to feel tired, you're going to feel upset, you're going to feel distressed, you're going to feel frustrated. Kids go through the same thing. However, as an adults, we may be able to somatize, we may be able to address it in some way or form. Maybe we can get distracted by reading a book or going outside, having a smoke, having a drink, something like that as an adult. But they are kids. As kids, the only thing that they're actually able to know is working with their own communication method. And if we're talking about a nonverbal kid, if we're talking about a kid that has limited to no social skills, the traditional response is going to be tantrum. It can be a screaming, it can be running a lot, it can be frustration, and they can actually reject the therapy exercises. So as soon as anybody is noticing that their kid is not cooperating anymore or enough with the activities that you are working with them every day on a daily basis at home, don't push it. Let's find a distraction. Let's have a time off. Let's go outside and play. Let's watch a 5-minute video. Let's cool down, and then we can go back, or we can try a new exercise, and then we can go back to it. Remember, if a kid gets frustrated, it's not very likely that that kid is going to retake that activity immediately. It may take 3, 4, 5 days, maybe a week for them to try it again. So those are some of the suggestions. Obviously, when we have our patients here, we go through some of the some more elaborate suggestions, because although we may have a bucket of 1,000 or 1,200 different suggestions, that doesn't mean that all of them are going to be suitable for one patient. It's pointless for us just to give you 1,000 suggestions if you're not going to use them. I'd rather give you 10 in order for you to use 5 and try to make the most out of that, and complement with every single input and follow up with your therapist and your doctors. Finally, I have here a video of what can actually be achieved. I will not say his name. However, this is a kid who was not eating. The only thing that he ate, it was in the shape of a pancake thing, and was nonverbal, 0 social skills, and this is how he's doing today.
Hey, say up. Yes, you did it. Up. Say mom. That was on your own. Yes, you got it. You got it. And you say ball. Say ball. Yes, you did it. Say bus. Bus. Yes, you did it. Oh my goodness. Say bye-bye. Bye-bye. Yes.
I know it's not the largest of the videos, but for the purpose of this lecture, in order to make it easy and simple, I wanted to share that with you. Now, finally, if there are some questions, I can address them now. If you want to, you can send me an email. You can write to Dr. Eduardo. Doesn't matter. What I want is you to actually take the moment of actually taking the work, taking the liberty to getting in touch with us, addressing your questions, your concerns, and actually address what is popping in your mind. Let's find a way by communicating, because trust starts with communication. Let's find a way on how we can help you, right? That is the objective. Money is not the first thing, despite what lots of people think, despite what the conception is. We understand that this is a business in the same way any other service is a business, but trust goes first. We have to figure out how to help a patient. We have to figure out how to help a family, and then we discuss finances. Finally, if there is a question, please let me know. You can write it down right here in the question section, and at the same time, if you want to, you can send it to our email addresses. I have a favor to ask you, if it's possible. I urge you to log into this link that we have here. And it's just a basic 5-question thing, because we want to know in a little bit more anonymous way, if you want to, what you're thinking, if this is helpful, what type of lectures or webinars or explanations you need, what is it taking, what is happening in your mind that it's causing some mental crash, that is causing you some distress that you want us to address, and we can do so. So please, if whenever you have chance, even if you're not watching this webinar live, the questionnaire is going to be open, because it's going to be posted in the community group. So we have a question here. We have a question that says, how many times do you recommend doing the stem cell therapy, and what is the oldest age is beneficial? This is let's address the first half of the question. It's from our side as a clinic, and me as an individual, is not ethical to say, you know what, sir, you know what, madam, I want you to be here 4 times in order for your kid to be able to ride a bike and say hello. It's impossible to predict the final outcome. As I said before, every kid has different levels of inflammation. Every kid has a different history of treatments. Every kid is going through different, let's say, detox protocols. Everybody, remember the images of the cells fighting between each other? Every kid is experiencing a tiny immunological war in a different way as another kid. There are some kids, there are some patients that with one treatment, they improve really good, and the family says, I'm gonna hold for a couple of months, for a couple of years, and then that patient comes back maybe 2.5 years later. As an example, the kid of the video that you just watched, that kid has been here 3 times. However, they had the advantage of starting the therapy when the kid was 3 years of age. So he was at a very early stage, and he was immediately worked or adequately worked in different areas, or what I like to say or to point as the weakest areas. Now that kid is gaining weight, now that kid is growing up in size, and most important, that kid is socially responding and verbally responding. So how many times do we recommend? I don't want to give you a number, because that is going to be your decision. If you want to come 3 times, let's make the best with 3 times. If you want to come 1 because you want to try the treatment, come 1 time, and let's make the best with 1 treatment. And if after this period of 6, 8, 10 months, you want to repeat the treatment because you notice some changes, you're welcome. Maybe aiming for a new change, maybe aiming to improve the changes that we have, or maybe looking for a new milestone. However, once again, we don't have the dirty ethics. Again, we have to build our results also in trust. It's impossible for 1 aspirin to take my headache away when it takes your headache away. Maybe I need 2, maybe I need 3, or maybe I don't need aspirin, maybe I need another thing. So in the case of our patients, how many times? Let's make the best with one. Let's follow up for the following months. We need a little bit of your help in that. Let's say, hey, you haven't noticed any changes. Let's break down what has been taking place on the past 1, 2, 3, 4, 5, 6 months. Let's understand what our patients has gone through. Let's understand what the therapies have been about. Let's understand what changes our patients have been going through. Maybe let's understand if there is a new immunological insult in order for us to find or to help you find why that kid is not improving. However, if the kid is improving and you want to repeat it, you are welcome. Now, what is the oldest age it's beneficial? As I said, my first old patient was 32 years of age and he was nonverbal. Even at 32 years of age, about 5, maybe 6 months later after the treatment, he still was nonverbal. He was actually able to respond with just a no. So for a 32-year patient whose parents at the time were like, let's say 70, 75, it's a huge step. It's a huge change, even in the body of an adult. So what I want to convey with this is, yes, there are patients who are adults that can improve. That's true. If you ask me what is the best time to proceed with the treatment in our patients, obviously the younger the better. Why is this? Because the younger the patient, the more plastic the brain can be. The easier for the brain to adapt, the easier for the brain to actually, let's put it this way, the easier for that brain to think out of the box. When we are treating an adult, yes, adults have actually good potential of improvement. However, it can be more complicated because we are working with a mature brain, a mature immune system. So the plasticity is not the same as a teenager, or it's not the same as a pediatric patient. I hope your answer is I hope your question is answered. Now, another question. Safety about the procedure, safety about the infusion of the cells, safety about collecting the cells. We have to break the side effects in two different areas. One, as a procedure, and two, as the use of the stem cells. As a procedure, the actual statistics are really, really good because regarding safety, we are not concerned. Usually the safety is about 98 to 99%. Worst case scenario regarding safety is that our patients may go through some sort of headache, perhaps nausea, or maybe throw up due to the sedation, because when they wake up in a matter of 15 to 20 minutes. Our patients may feel a little bit dizzy. That is the reason why. Perhaps a little bit of a headache. Usually in the following 12 hours, everything clears up, and by the next day, when they come for another infusion of the cells, they are pretty much good as new. Now, regarding safety about using the stem cells, this is the reason why we actually applied and submitted our protocols to the government, because the treatment is safe. If the treatment were not safe, we wouldn't be authorized to do this legally, which is another important thing. Our clinic has the necessary licenses to perform this legally. That is the reason why we do it in a hospital. Now, as I said before, autologous stem cells cannot be rejected. Allogeneic stem cells cannot be rejected. However, those require a different approach that we can discuss in person depending on the needs of every family. Now, I don't know if there is another question. Once again, if you don't want to ask the questions here, feel free to send us an email. Feel free to send us give us a call. As you can see in our webpage, there is a link that says free evaluation or free discovery call. You can click on there. We can have a quick conversation, address your concerns. If this is something that you believe that can be suitable for you, phenomenal. If you believe that this is something that is not exactly for you and you want to postpone it, doesn't matter. Let's address your questions. Let's provide the necessary information. Let's straight your research, and maybe you can make the decision later down the road. So, well, I don't see any other question at the time. So once again, this is Dr. Alberto, broadcasting from Western Cells Clinic at the time. So I really appreciate your time. Thank you for taking the time. I was aiming for this to last for about 35 minutes. It's been an hour. So thank you so much. I hope this clears up some of your questions. If not, feel free. I'm happy to help. I wish you have an excellent day. Please take care. Have an excellent weekend.